Okay, we'll get going here in a couple of minutes. Okay, we are right at 1:15, so we'll go ahead and get going. Welcome again to our weekly virtual news conference with the city, the county, Indiana University, and IU Health to discuss our coordinated efforts regarding the COVID-19 pandemic. Today, as always, we will be joined by Mayor John Hamilton, also Monroe County Commissioner Julie Thomas, IU Health South Central Regional President Brian Shockney, Monroe County Health Department Administrator Penny Caudle, Monroe County Emergency Management Director Allison Moore, and IU Assistant Vice President for Strategic Partnerships, Kirk White. And to begin today, we will go to Penny Caudle because she has some significant news regarding the county.
Sure, thank you very much. Can you hear me okay, Chuck?
Yes.
Have a different setup today, and so it's unfamiliar. So you know how that goes.
Sounds good.
Thank you. I want to start with our sort of basic information about our health department, and that our main level of our health services building, where our office is going to be temporarily relocating next week. And so our main office, which includes vital records, and that's birth and death records, environmental health, the administrative side, will be relocating to North Showers building. We'll be closed next Tuesday through Friday for that move and setup, and we will be in that location until probably December. The lower level of the health services building houses our Futures Family Planning Clinic, the disease intervention specialists, our education staff, and our public health emergency preparedness staff, and that will remain open during this time. So I just wanted to let people know about that move. And next week, between Tuesday and Friday, many of us will not have access to our phones or computers during that move and transition. So please, if there are general questions, we encourage you to check out our website or the state's website or the CDC's website to get those answers. In an emergency, certainly other staff or the commissioners will be able to get a hold of us, but for routine things, non-urgent things, we will be out of commission for a little bit next week. And just to add to that, all of this started last year before COVID-19 hit. So this is just the way timing happens sometimes. So unfortunate timing, but we are looking forward to having some refurbishing of our main offices and coming back and being more efficient because of that. So thanks for everybody's patience during these next few months with that. I know that the thing that people are most waiting to hear about is the next health order. And the health officer, myself, have been working with our elected officials, the hospital, the university, and others regarding what the anticipated face covering requirements may be and what other things may be in the next order. So the order is not yet finished, but we are working on it, and we wanted to share some of the anticipated things that may be included in that, just to give people some advance notice for planning purposes, recognizing again that the official order is not complete. These are possibilities, and we'll be releasing that order in the next couple of weeks. We do expect it to go into place no later than the end of July, but we'll get that out as soon as we can finalize some of these fine details in there. At this time, I would say, however, one thing that has not changed is as community members, we need to understand that we do need masks as a part of our vital part of prevention and in the spread of COVID-19, that they need to be worn over the nose and mouth when we're in public and we're unable to distance. So if we're inside a business and we're shopping, we need to really have that face covering on. If we're outdoors in groups and near others and not able to distance, we need to have that face covering on. And that is true whether we have a requirement for that or it's recommended. That's just a personal action that we should all be taking. And it's what we've really been striving for all along, is to get people to understand the importance of that and to do it on their own so that a mandate isn't required. The other things that we are looking at to include, masks are not in and of themselves the only prevention method. So we're looking at other things, and that can include indoor seating and that being spaced well so that we allow for distancing when we are inside businesses. And that may be included. So while it may be recommended, we're looking at having a requirement for that distancing regardless of what the capacity limit is. We also know that markings help people know how far to stand apart. And if we're in line, how do we need to space ourselves? So we're looking at whether or not it's feasible to require some markings as well. And how might we provide those to businesses or help them make that happen? Social gathering size is also being looked at and evaluated. Do we keep it at 150 inside or 150 outside and 100 inside? Does it need to be lower? Can we go higher? Those kinds of things. So we are looking at those numbers now as well. While there is community support, and we recognize there are a large number of people who are supportive of a mask requirement, and some people wish that it was in place back in March. Others are clearly also letting us know that they are not in support of that. So we do hope to find some balance as we look at best public health practices around mask coverings or face coverings, sorry. We do understand that with this requirement, there'll also need to be some reasonable expectations and exceptions and accommodations that will need to be made. One example is to allow face shields for people who may not be able to wear a face covering. So we're looking at those kinds of things so that we can include them in this order. We also have to look at how we will handle complaints. So how will they be taken? How will they be processed? And given changes, if we expand an order, then we have to look at our current practices and how they'll be impacted and how they need to change. So we are doing that currently. We also have to continue to look at enforcement and follow up and how it will be addressed differently. Of course, the intent with enforcement actions is always to get voluntary compliance. We don't ever want to have to issue fines, but we also know that there has to be some means to move forward if someone is, or a business is unwilling to comply. So we need a variety of options, and we just hope that everybody will comply on their own, and a requirement even coming won't necessarily be needed. We do want to remind everyone of ways to get masks, and that information is on our website, but it is easy to make a face covering. You can do that with a bandana, a sock, a t-shirt, a large table napkin. Those are easy, inexpensive ways, don't require sewing to make a face covering for someone. So you don't have to have a fancy one, that is for sure. Some people may be asking what's driving this. I reported earlier in the week that while our ICU numbers and vents and the hospital admissions for COVID are stable, and Brian Shockney, I'm sure, will share more information about the current status of the hospitals. Our percentage of tests that are positive is at 3.6%. And while that number is low, it is still increasing. What's really concerning is that we are seeing more testing, especially among our 20 and 30-year-olds. And that's good, but it's also where we're seeing the most of our new cases come from. And that's a concern. So we just want to remind everyone again, regardless of age, that social gatherings, being in groups of people who are not distanced, not wearing face coverings, we really only need one person who's infected, who may not know it, to be present and spread the virus to a large group of people. And that's why it's important to keep those social gatherings limited, to not be in large groups without taking additional precautions. It's very important for people to follow all directives. So when someone is positive, they need to cooperate with the contact tracers so that close contacts can be assisted in short order. And it is good for us. We want to identify positive cases. So we're glad that people are going in and getting tested. We want to be able to identify those cases so that we can get them to self-isolate quickly, and that all their close contacts can quarantine so that we can stop the spread of this infection. So that's where we are today. Our case count today is 329 cases. 3.6% of all the tests that were done were positive. 25.2% of our positives are in the 20 to 29-year-old age group. Thank you.
Okay, thank you, Penny. Let's stick with the county. We'll go to Julie Thomas, Monroe County Commissioner.
Hello, everyone. Thank you so much. Just a couple of quick updates. We completed our grants to local businesses and organizations, 32 of them to be exact, and the total was over $399,000. And I'm sure Allison will be talking about the fourth blood drive coming up July 28th. But also just a note that county buildings are open by appointment only. Clearly, the health department is an exception to that next week because they are getting some renovations done. If you do want to visit any county department, excuse me, just either call them or check out their webpage for information on how to make that appointment. Face coverings will be required, either a face mask or a shield to enter a county building, and they will be provided for you if you need it. Also, our boards and commissions continue to meet. They're meeting via Zoom. You can find the calendar at the bottom of co.monroe.in.us for links to the Zoom meetings and also to agendas and packets. We also are very grateful to Downtown Bloomington, Inc. and also the Bloomington Chamber of Commerce. And they're helping us distribute these decals. This is a large version, decals for windows for organizations or retail. Or you can come by the courthouse at the north door Tuesdays and Thursdays, 10 a.m. to noon, or 1 p.m. to 3 p.m. to pick up yours, no cost, of course. Or you may contact our office at 812-349-2550. And just a quick thank you to everyone who is practicing physical distancing and wearing those face coverings. It's a good way to support our local businesses to ensure that we don't have to shut down again. It's of course a very patriotic thing to do. It shows that you care and you respect other members of your community. If you are contacted, if you do have a positive test and you're contacted by a contact tracing person, please cooperate with them. That will make a huge difference for us. We appreciate everyone in our community and all their hard work. Thank you.
Okay, and sticking again with the county, Allison Moore.
Good afternoon, everyone. Yes, Julie Thomas mentioned the fourth blood drive. It is the final blood drive that we're having from COVID, lack of blood, and that is scheduled for July 28th. It is going to be at the Monroe County Convention Center. We actually have two blood drives left, July 17th and July 28th. July 17th is full because these blood drives are, of course, by appointment only due to COVID. But there are still many spots open for the July 28th site, and you can register for your specific time by going to the redcross.org website, putting in a Bloomington zip code, finding the Monroe County Convention Center, and then selecting a time frame that works for you. That information is also on our county website as well. We also are continuing to collect homemade cloth masks so that we can turn around and distribute those to people in our community that might need those. And we have continued week after week to continue to get those masks collected. And so we thank those individuals for doing so. And we are continuing to collect those. Our sites for drop-offs are also on our website. And you can find that at co.monroe.in.us. And then lastly, I just want to mention that this week we received a great big allotment of supplies for our public and private schools that we were able to shuffle around and distribute to those schools. Those came from the Indiana Department of Education and the Indiana Department of Homeland Security. So I just want the public to know that we received those supplies. They've been distributed to your public and private schools. I know there are many parents out there that have those concerns that are there going to be masks and such supplies available. So your school administrators have been working super hard to make those requests, and our state was able to allow us to send those this week, and they have those in hand. So that's all I have, Chuck. Thank you so much.
Okay, let's go to Bloomington Mayor John Hamilton.
Thanks, Chuck. Can you hear me all right?
Gotcha.
Good. I just want to make two points at the outset. First, our community has experienced real trauma since one of our own was assaulted in an apparent hate crime near Lake Monroe over the July 4th weekend. I'm not going to be discussing that directly today unless there are questions about it, but I also don't want to appear publicly without acknowledging the very real hurt and pain that we are all experiencing from this awful incident, especially our brothers and sisters of color. Second, I want to just update on our two firefighter cases mentioned last week. Both have recovered fully, and just report that the protocols in place there have appeared to prevent any spread at the workplace or exposure to public members. So we're pleased with that. And now as to the COVID issues, I'm very pleased that County Health is discussing these steps. Details, of course, still to be determined, as you've heard. We are in good shape now overall, though we still need more testing, but there are very serious threats to our situation. First, the national stories, which we all see, and the explosion of cases with opening too quickly or other protocols that have caused that. And second, we know thousands of students will be returning in the weeks ahead. It's 4 months ago tomorrow that the World Health Organization declared a pandemic, just 4 months. And during those past 4 months, we have done a lot of good, a lot of hard work together. And we're in a pretty good spot because of it in our community and in our state. For the next approximately 4 months, which will take us but basically up to Thanksgiving, if we're cautious and prudent, I believe we can continue our good story. I certainly hope so. I believe that means we really do need to impose face covering and masking requirements, and it means we really need to do all we can to avoid super spreader events. I would note, I think there are two important lessons that we've gotten from the recent past. One, be careful and follow the data and the science, and I appreciate all that is being done on that. And two, don't be afraid to take local steps that are different from the state or national rhetoric in light of our local conditions. And I strongly support the health department look to outline a potential plan of local requirements for face coverings and to take steps that significantly limit the risk of super spreader events locally, particularly indoor, non-distanced, long exposure events with large numbers of people in them. We in the city government will continue to look forward to collaborating with all the folks on this call and otherwise, and look forward to the good hard work over the next 4 months to make sure we can keep as safe as possible. Thanks. Back to you, Chuck.
Good news is those 4 months only feel like about 12, I think. So,
Yeah, I hear you.
so let's go to Kirk, Indiana University update.
Well, good afternoon, everyone. At Indiana University, we're continuing our deliberate planning for the restart at the Bloomington campus, which, as you might imagine, is very complicated because it's different than what we're used to in integrating our 40-some thousand students back to the campus. So lots of our people are working diligently on ways to restart the campus, both with our faculty and staff and our students, in order to follow the distancing, masking, and other sanitation protocols that we will enforce while our university community is on campus. So much of that is going on, lots of hard work on an hour-by-hour basis to get that done. And we'll hope that all those preparations come together in time for us to get restarted as a semester late next month. Another update is we will, of course, be with our mask mandate for the campus. We'll be providing 2 masks for all of our faculty, staff, and students. The new masks are expected to be mailed to our faculty and staff the first part of August, and our students will receive them upon arrival to the campus. So that's the update from Indiana University today.
Okay, next go to Brian Shockney.
Good afternoon. Thank you for everyone being on the call. We today want to reinforce the safety pieces of what we're seeing. As was mentioned before, across the state of Indiana, we've seen the second largest increase in positives in the state of Indiana since April, when we were in our surge. And that data was released by the Indiana State Department of Health this week. And so we have concern that we need to do all the things that have already been discussed: wearing face masks, practicing good hand hygiene, social distancing, and staying at home when you can. So our healthcare teams are working diligently to be sure that we're modeling that behavior as well in public. But one thing that we've been hearing, we have a large pediatric practice, and one of the things we've been hearing is concern regarding kids going to preschool, back to school, face masks, those kinds of things. And so we know of some things that can really help with if you're a parent or guardian of a child, and we would encourage you to do in the next several weeks as we plan for the reopening of schools. And that is encouraging parents and children to start having their kids, their children, wear masks. Give them time to look at the mask, to watch you put yours on, model that behavior, and teach them how to take theirs, put theirs on and take theirs off as well. So you're normalizing this mask as part of their everyday life. And so that will help our community, but it will also help the schools and all the places that our children frequent, that this will be a part of their normalized day. So start wearing your masks around the house. Encourage your children to practice wearing theirs, and even incorporate it into time out in the playtime and time outside as well, so that they are familiar with that. As Penny mentioned, we're seeing this increase in the younger, the 20 to 29-year-old is where we're seeing our largest increases. And many of those of that age are parent or childbearing years. So they have children as well. So we need to just make sure we're stressing that our children see the value and understand the importance of wearing masks. And it's not a scary thing to them, but it's part of what we do as adults in society to protect ourselves and others, and that they want to be a part of that as well. And with that, I'll end my comments and take questions.
Okay, and we can open it up for questions. We've got quite a few. I actually want to jump into a series of questions we've had come in on Facebook already about schools. And so one involves, why are schools being open when government buildings remain closed to the public, like the health department? And another, can the health department please share specific criteria on how the determination is made to close schools due to COVID cases.
Thanks for those questions. I'll try to answer them as best I can. First, I would say that the health department has been operating and working overtime all since January in terms of COVID. The county offices are open by appointment. They're not completely closed. So just to clarify that, I think the goal when we think about schools reopening and you know, the governor wanting them open, everybody is looking to ensure that our children have both the physical, the mental, the social, and the educational aspects of being in school. And certainly it needs to be a safe place, and the schools are working with the guidance to try to make it as safe as they possibly can. We know not being out in the community at all is not 100% safe as well. So nowhere are we completely safe and outside of the potential to be exposed to this infection. So the schools are working very hard with the guidance in order to open safely. So that would be how I would answer that. In terms of what happens if there's a positive, there's two things. When someone tests, let's just assume that it's a child and they test positive, the provider will notify that parent of that positive test and what they need to do. And then the provider will report that, and that will get reported to the state, and we'll go through the contact tracers to do an interview. It will go to our local health nurses. So the system that's in place is for the parents to also notify the school. And if they do that promptly, then the idea is the school will contact the health department, and hopefully that will happen as quick as possible, so that one way or the other, whichever is quickest, the nurses and the health department are able to work with the school very quickly to identify where in the school there may have been exposure. So are there particular areas of the school that need to be closed and cleaned? Was the student, or if it was a faculty member, were they throughout the school and maybe a larger portion of it needed to be closed? Did the student ride a bus where maybe other children were on the bus? Those kinds of things. So that when we talk about closing schools, it is as much about closing the school to ensure that the cleaning is done, and then schools can reopen, and it gives us time to make sure that we're contacting the people who are determined to be close contacts. So just because a student may be in a school and that student is positive does not mean that the whole school necessarily has to close down, right? It may be a classroom, it may be an area. It doesn't mean that the whole school system needs to close down. So we have to assess. It could make a difference on whether or not it was a family and several members of that family were positive, or whether or not it was an individual. So I can't, you know, each scenario will be a little different, but those are the things that we'll be looking at.
Go ahead, Mayor Hamilton.
If I might just add, and I know everybody on this call has been working closely with the schools, of course, the health department most of all, and we appreciate that. Having been a school board member long ago, they are facing incredibly complicated challenges and balancing the things that Ms. Cottle very accurately described. I think I would just add, resources are really important for schools too. They're opening safely means having to change what they do, sometimes change their physical plants, reduce the density of students and protecting teachers. And it's really complicated, and our hearts go out to them. But I also think we ought to be encouraging state and federal resources to help flow to the schools, because their opening is really important if it can be done safely, but it's going to be more expensive. We just have to accept that. Thank you.
Related again to schools, question from Emily Ernsberger from the HT for Penny. While Allison talked about masks being available in schools, will the schools be required to follow the mask order for reopening should there be a mask mandate?
Well, that is part of the conversation. You know, It is easy sometimes to say just require masks, but there are lots of different things to think through. We certainly expect, because the schools are following Department of Education, State Department of Health, and talking with local health departments, and following CDC guidelines, that though, as long as those are being followed, that would be the expectation. I don't think that they will be much different than our local ordinance is likely to be, or a local order is likely to be. But definitely we want schools to be following Department of Education, CDC, and state guidelines.
Question from the B Square Beacon, Dave Askins, for everyone, or for Penny Caudle and Mayor Hamilton. Based on the city council's work session that took place at noon today, it sounds like some city council members are eager to enact an ordinance that requires mask wearing if the next county order does not have a requirement. That would mean that the city would have one set of rules and the county another, which seems not a great situation. Does that affect your thinking at all in thinking about whether to impose a requirement? And he adds, parenthetically, from what you said, it sounded to me like the county is hoping to avoid having an absolute requirement.
Well, certainly I'll go first. We would have liked to had an absolute requirement. That's what we've been working toward all along. But as things change and as we prepare for a changing population and increased activity, schools opening, businesses reopening, all of those things, it does change things when we see positive cases increasing. And so that is really what's driving it. All of our conversations have been around how can we do this cooperatively and together so that we don't have different requirements in different parts of the county.
Yeah, I'll just add, I think we've tried to follow the science and the data from the beginning. We collectively, and I know the health department and health officer have done that. We've kind of edged up to mask requirements. There have certainly been people encouraging that. I do think it's accurate that inside the city, there's a fairly strong push as people have looked at evidence around the country, and also the fact of so many students likely to come back to Indiana University. There's a lot of interest in that. I think everybody is working to see if we can have a consistent rule, because I think that is easier for the population as a whole. But I do think, as I mentioned last week, I think there's a fairly strong feeling and judgment from city officials, and myself included, that having a fairly substantial mask mandate, face covering mandate, particularly in the next few weeks, months, is a prudent thing to do. And I know that the county's looking really hard at that, and we're working together on that, and we'll see where we come out in the next week or so. I look forward to doing that.
Okay. Along those same lines, a question that came in on Facebook. I heard the Bloomington mask drive supplied thousands of face masks to all city employees and departments back in April. Did the city provide them any financial or other sort of resources? And is the city of Bloomington still working in collaboration with the Bloomington mask drive?
I guess I'll take that. I think if what you're referring to is the collaboration with the volunteer mask makers, the troops of mask makers that have been hard at work, absolutely, the city did work with them, as others did too, locating facilities and helping with logistics, and we're continuing to do that. We have provided masks to our 750 employees or so, and to those who are coming to City Hall who don't have a mask. And I know the community has done a great job, county, emergency management, volunteers, to help provide face coverings for those who can't otherwise provide them, and we'll keep doing that.
Question from Emily Ernstberger at the HT. Now that places like OptumServe site allow anyone to get a test, we've heard anecdotally that many people are planning to get multiple tests, such as on a monthly basis. Do you think that is a good idea given limited testing resources? People we hear this from seem to be restaurant and service workers, she says.
You know, Emily, we hear that a lot with, we're going to test everybody here. We're going to keep testing. There's some benefit certainly in testing, because we know that people may be asymptomatic and they may pick it up. What I hear in that question and sometimes that thought is that I won't take risk, or, you know, I won't take prevention measures. I'm just going to keep testing. And that's not prevention. So the testing is about finding out if if I've become infected. And remember that, you know, testing is a snapshot in time. And so I understand why people may want to do that. I would not encourage people to routinely just say, I'm going to test every month. It can be a strain on resources, but certainly if people have been exposed, if they've been in a situation where they feel they've been at risk, then it would make sense to test again, even though they may have been tested before. But prevention is the key so that hopefully don't need to be tested.
And I would just add too, you know, Indiana is still in a pretty low testing environment compared to the country and compared to the what professionals tell us we should have. Monroe County itself has had, I think, some access issues. Anecdotally, I know some people who tried to get a test here and had to go to Seymour because they couldn't get in for a week and a half. But so I do think we need to be careful about testing unnecessarily, just as Administrator Cottle said, and also hope we can get more testing continued availability, which is really important in the long run.
Another question from Dave Askins for Penny Cottle and Mayor Hamilton. Can the mayor, as the executive of missing a word here, it says the executive just issue a mask order himself for Bloomington? I'll get this, invoking some kind of emergency powers without going through the city council.
Mute, sorry. We have looked at the legal authorities. I think the short answer to that is yes, legally, but I would expect to work closely with city council if needed to do that, and they could take action after the mayor has the authority to take some action. But again, we look forward to working with the county. You know, we think it's clearer and easier if we have consistent rules, but I think technically the answer to that is yes.
Question for Penny Cottle. Can you clarify the role of the Public Health Board in working with the health officer to create the next order?
Certainly. The Indiana Code gives authority and powers to the health officer for emergencies to do emergency orders. So whenever there's an outbreak or a public health emergency, it's the health officer who has the authority to quarantine, to isolate, to put in those kinds of orders in order to prevent or reduce the spread of a communicable disease. The Board of Health is our policy arm and kind of our overarching authority, and they hire the health officer. The health officer is responsible for hiring the health department staff, if you will.
Okay, Julie, you wanted to add something here.
Yeah, I thank you so much, Chuck. I appreciate that. I think this really raises that issue again of, are we going to work together? And I think it makes sense for our community at large to work together, because we do cross between city and county a number of times a day for those of us who are actively working and in the community. And it just makes sense to have one order for the entire county. And then the question is raised, you know, are we going to enforce the order? And that's a big question. And it's very important that we have everybody's support on that. Thank you.
Question again from Dave Askins at the V-Square Beacon for Penny Cottle. The 3.6% positive test rate that you mentioned looks like that's the cumulative rate since the beginning of the pandemic. But if we look at the rolling 7-day average of positive test rate, we've actually shown a clear increase over the last 2 to 3 weeks, from generally between 1% and 2% to now when we're sitting around 5%. Is there a working theory on the recent increase in the positive test rate?
Dave, you're right. When we look at that 3%, we're talking about all of the tests that have been done and the positives. And that does not you know, in an ideal world, that would be each individual person. And it would be broken down in that manner, and it isn't. So it does also tell us about, you know, some of those individual tests may have been people who have tested multiple times. So that does skew some of that. We do have some limitations with the data that we have and how it comes into us. Certainly, as I mentioned before, we're concerned because the number of tests that are being done certainly are increasing among our young people, but the rate of positives that we're getting is certainly concerning. And that is definitely a factor as we look at all the various ways that we might be able to reduce the spread of infection.
Question from WFIU News, Binta Boutier for Penny again. We've seen an uptick in cases and cancellations at OptumServe. Are there any plans to keep testing consistent through heat challenges?
Well, we would love to do that. And again, I say we do not run that clinic. We don't manage that clinic, but it is in a facility that gets hot. And when the heat, you know, indexes and the humidity is so high, it's very difficult to maintain safety of those employees when they're in PPE. So they have been closing early. The Optum sites are definitely scheduled through July. I hope and anticipate that they'll be in place through August. I don't know how long the state will keep them open. I think as long as they're busy, then we have a better chance of keeping them open. So I will say this, the staff here locally have done a great job of working people in that had appointments that needed to be rescheduled, and they have still done many days, as many tests as they would have done had they not closed early. So I recognize and totally, I do understand the frustration of people when appointments are canceled, or maybe they didn't get canceled and they should have been because they closed. I have heard that message. We've shared that with LHI that runs the Optum sites, and hopefully that will be resolved. We've encouraged them actually to just consider while we're in the midst of July and August and it's hot, just regularly, that perhaps the hours should be shortened and maybe they just try to schedule the appointments more closely together.
A question also from Binta. I think you covered this already in the opening, but for Penny again, any more information on when the health department will be moving and where while their service building is under renovation?
We are moving next week. We will be closed Tuesday through Friday for that move, for packing and moving and setting back up. So we'll come back online kind of slowly and probably individually and have to catch up a little bit. We're moving to the north end of the Showers building. So the county portion of the Showers building will be on the second floor. We will be there probably until December.
Question for Brian Shockney. Hospitalizations are up statewide. What about at Bloomington?
Yeah, Chuck, do you have those two slides?
Yes.
Put those up. They are up. They're not significantly up comparatively, but we have seen, as we were talking about weekly percentage positive numbers, this is not just hospitalizations for us, it's also Monroe Hospital. It looks, it is up, but if you go to the next slide, Chuck, please, you'll see that by week, you can see where, we were very high, but we're seeing this trend the last couple weeks of higher admissions, both here at Bloomington Hospital as well as Monroe Hospital. So while not alarming, we've not had to open any additional units at this point. As Penny has said many times, we're looking at all data, right? So we're looking at the number of cases, we're looking at percentages, we're looking at hospitalizations. And with the increase in percent of the 20 to 29-year-olds, the number of cases statewide, hospitalizations statewide, and our two hospitals here in Bloomington with a small uptick, but an uptick, there is a concern that we need to really be diligent in wearing our face masks and doing everything that we can to prevent the spread of this virus.
Okay, thank you, Brian. And let's see, I'm looking through these. We got about 2 minutes here. And not seeing, I'm going back up. Apologize. I'm trying to find a couple of Facebook questions here. Here's one regarding, I believe, the school reopening process. Sounds like a lengthy and inefficient process for students and parents. What is the rush towards reopening when it can cause such concern and risk? Or whomever wants to take that.
I'm not sure that there are any of us that have the control over the direction for that. That is probably a question better answered by the Department of Education, perhaps.
Okay.
I would comment, I mean, I appreciate the question. These are really difficult, challenging circumstances. We know that when schools are closed, it has a major impact on families, households, the community, the jobs and the economy, the welfare of those households, the health of those households. A lot of evidence, I'm no expert in it, but on the major education impact that can have a lifelong effect on young people, particularly young kids. So it is really, the stakes are really high in continuing to get the education system working. And I know people are heroically trying to keep it working. So I know the school system is working very hard. It is messy and complicated and lengthy and inefficient. That's probably all true, but it's the one we have. And I think the continued conversations about how to do it safely, it won't be perfect. There will be mistakes, but I think we all want to try to help look at what are the best ways to do it. Learning from what's been done around the country and not being afraid to have local conditions that direct us toward other things. So it is going to be, I was just going to say, it will be lengthy and inefficient. It's just the way it is because the stakes are really high.
And one last clarifying question from the B Square Beacon and Dave for Penny. Wanted to confirm my understanding based on what you just said. The Board of Health does not need to meet and vote on a health order, correct?
That is correct. Now, the health board did meet a week ago, I think, 10 days ago. They did talk about the orders, and that's really where we came decided upon having the requirement for signage as really kind of that first step for movement toward a potential mask order. But the health officer has the authority to do the health orders, not the health board.
Okay. With that, we will leave it there. We will be back next week at the same time, 1 o'clock on Friday, and look for the advisory on Friday morning. I'm sorry, 1:15. We all join at 1 o'clock, and then we start this at 1:15. So we'll look for you then, and appreciate your time this week.
Thank you all. Have a
Thanks,
great
Chuck.
weekend.
Be well, everyone.